Okay, I think we're going. Hi, everyone. Welcome to all those who are tuning in. Today, we're conducting an interview as a part of a larger project that the University of Minnesota Law School's Journal of Law and Inequality is conducting, where we're exploring a variety of topics at the intersection of law and equality and how those are interacting or being affected by the coronavirus even further. So today with us, we have the Executive Director at Gender Justice, Megan Peterson. Megan joined Gender Justice in 2016 after a really fantastic career at the National Network of Abortion Funds, where she was the Deputy Director. She was also the Director of Development and Communications, did a lot of fantastic work for a campaign to repeal the Hyde Amendment, and was also a patient advocate for Planned Parenthood. So she has a lot of expertise on our topic today. We are very pleased to have her. And also with me are two very talented other members of our journal, Ann, Wen, and Anna. And so I guess to get us started, we're gonna start with what I think is Megan's bread and butter. I wanted to ask you, Megan, if you can talk about, we know that there are a lot of states that are using the coronavirus as a way to potentially curtail women's access to safe and legal abortion. Can you talk about that phenomenon and if gender, what role in that gender justice is playing?
Sure. Yeah. Thanks so much for asking me to have this conversation, and excited to be with you all. Yeah, I mean, I think that this effort on the part of some anti-abortion governors in various states to kind of carve out abortion access and use the COVID-19 pandemic as an excuse to do it is really heartless, and also just lays bare that those that seek to ban abortion will use whatever tools they have available to them to do that, including a global pandemic. So we have seen, governors take that step in a handful of states. Those efforts have been challenged in the courts to mixed results. For instance, in Texas, it goes back and forth seemingly at a dizzying rate. And unfortunately, here in Minnesota, although fortunately our governor did include access to abortion and reproductive health services as part of what was considered essential healthcare services, there has been a lawsuit filed by a clinic that calls themselves a pro-life clinic, and a handful of organizations and individuals in the state here claiming that because of the restrictions on PPE, abortion clinics should also be forced to close here in Minnesota. And so we have been involved in that, in responding to the case. And they sued all of the abortion clinics in Minnesota in that case. And so we're working with some of those clinics to respond, and they are seeking a preliminary injunction, with the governor indicating that he plans to kind of reopen the healthcare system here in Minnesota to not be limiting, procedures and such at the level that they were under the shelter-in-place order. Perhaps this lawsuit will become moot very, very quickly, but it is, unfortunately, another example of just the ways in which they will make, ludicrous claims and arguments about abortion in order to try and keep it from happening.
I know for some of the people who are watching the video might not know that, I know one of the tactics is, or possibly the main one, is saying that abortion is actually a non-essential operation. Right. So that's kind of the tactic. Can you either speak on that, and or are there other tactics that are being used by states other than the kind of essential, non-essential dichotomy to try to curb abortion?
Yeah, I mean, for sure, in this, in the context of COVID, the essential, non-essential is really the primary strategy. And, it's frustrating because there's language that is used by the medical community that is maybe different from the language that activists or just, regular people use. And I like to talk about abortion in the context really of pregnancy care, and in the framework that if you are pregnant, it is essential that you receive healthcare related to your pregnancy. So for people who intend to continue with their pregnancy, that would be having access to prenatal care. I don't think anyone would argue that prenatal care is not essential, even during a pandemic. And so then for those who plan not to continue their pregnancy, getting access to an abortion in a timely manner is obviously essential. It's part of pregnancy care that can't be delayed. You can't put your pregnancy on pause while there's a pandemic. Your pregnancy is going to continue regardless of what else is going on in the world. And in fact, for people who do intend to end their pregnancies, having to wait some unknown amount of time, pushes them further into pregnancy, which if they intend to have an abortion, that means their abortion gets more expensive. It also, the later you get into pregnancy, can be more complicated, potentially have higher health risks, which abortion is extremely, extremely safe. That's another thing that anti-abortion folks like to try and kind of put out into the world, is that it's somehow, a risk, which it's not. It's safer than a colonoscopy. But the further you get into pregnancy, you're also then, as a person who doesn't want to be pregnant, living with a pregnancy for even a longer amount of time. And in the midst of a global pandemic where anxiety is extremely high, where there's a lot of economic uncertainty, people losing their jobs, people being stuck in their houses, potentially with abusive partners, there's just a lot of factors that are potentially more extreme in this period of time in people's lives. And to have to manage an unwanted pregnancy in the midst of that, and to have avenues to ending that pregnancy being shut off to you, only increases, I think, people's fear and desperation. So it's yet another reason why it's so important that clinics are open and people are able to get access to abortion in a timely manner.
Have you seen that? I mean, I think in a period of time where there's a lot of financial and health insecurity, that actually abortion access might even be more essential in a time of pandemic, because maybe a lot of women are afraid of, not being able to get the healthcare they need when they go into labor. They don't know, what our hospital is going to look like in 9 months. And what is my financial situation going to look like? Is that something that you've seen, or can you talk about that? Or do you think it's pretty much going to be the same as it usually is?
Yeah, so at Gender Justice, obviously, we're not a healthcare provider ourselves, so I can't, speak directly to the experiences of what clinics are seeing. But we, do work closely with clinics and also with the abortion fund here in Minnesota. There are two. Hot Dish Militia is in Duluth, and they serve patients at the We Health Clinic there. And Our Justice is one of actually the oldest abortion funds in the nation, and they're based in Minneapolis and serve people throughout the region. And they are getting more requests from callers who need financial help to obtain an abortion. I mean, the unfortunate reality is that economic concerns is one of the most common reasons people cite for seeking abortion. And, honestly, for an organization like Gender Justice, we would like to see that reason for abortion going down. Like, we would like to see that we have systems like universal health care, access to child care, better protections for parenting workers so that they don't feel like they have to choose between their job and having a baby. We would like to see that intersection between economics and parenting change in a way where maybe more people feel like they can become parents and don't have to choose abortion for economic reasons. But the reality right now is that it is a huge driving factor as to why people decide not to become a parent or not to have another child. And so certainly in the context of the pandemic, a looming recession, record high unemployment, it, is very clearly something that is factoring into people's decisions, because there isn't a more consequential decision than whether or not to become a parent or to add another child to your family. And obviously the health, safety, and well-being of any family is going to be a huge consideration in that. And if people aren't working, or they have, food insecurity, or housing insecurity in the midst of this pandemic, that is obviously going to factor into that really important decision.
Right. And then can you talk about, I mean, in the states that are trying to put in some of these restrictions, what are the consequences of that? Other than, I mean, the first and foremost is that most women wouldn't be able to access safe and legal abortion. And can you talk about, like, what are the ripples after that?
Yes. So, even in Texas, where it seems like right now, anyway, the battle is is kind of over. The state has given up and is allowing abortions to happen. One of the immediate impact has just been chaos. Clinics opening, then closing, and then opening, and then closing, and patients thinking they're going to drive 4 hours for their abortion, then getting a phone call in the morning being like, "Oh, sorry, the court decision came in, and we're closed again today. We'll call you back in a couple days." Like, it's just for for a time that is already an emotional roller coaster for everyone, it just like takes it to new heights to have to be dealing with politicians playing with your healthcare, basically, is what it is. So that's one of the immediate impacts, is just increases the stress and the strain on everyone. But longer term, there is a really great study. It's called the Turnaway Study. It's from the University of California, San Francisco. They have a research program there called ANSIRH, ANSIRH. I think that stands for Advancing New Standards in Reproductive Health. And they have done a long-term, longitudinal study tracking abortion patients who were turned away from receiving an abortion, and also a control group of people who did go through their abortion. And they have been putting out papers kind of showing what is the long-term effect of being denied an abortion. The good news is that what we know about people to be true, which is that we're adaptable human beings, and we're resilient, and we, find ways to survive, is true. And so, people, even though they maybe weren't planning to have an abortion, they're still capable of being a happy, healthy parent, right? However, what the study has found and demonstrated consistently each time they come out with more information is that those who were turned away are far more likely to experience deeper poverty. They are far more likely to need to be enrolled in public services to help take care of their family. They are more likely to have had their education derailed or delayed significantly. So, the things that really are like common sense, well, of course, like becoming a parent when you don't intend to, has a big impact on your financial well-being and on your life plans. It's really validating to see that play out in a way in the research as well, that they are able to kind of track those long-term effects. And so that is one of the really unfortunate realities, is that does derail people's lives.
I'm not sure if the study looked at this as well, but I mean, then we're looking at this control group of individuals who terminated their pregnancy or were not denied. And then, these women who went forth and had the child. But are you concerned about more women turning towards unsafe abortions and what that would mean for maternal mortality in these states?
Yeah, so, one of the things that is a positive in the time that we're in right now is that we do have medication alternatives to what is commonly called surgical abortion, but I see more people referring to it as procedural abortion, because surgery implies cutting and like things that don't actually happen during like an in-clinic procedural abortion. But medication is widely available and used in a lot of other countries where medications like misoprostol are available over the counter. And here in the United States, they're not, you have to have a prescription But if you get a medication abortion in a clinic, it's a 2-medicine procedure, so to speak. And the first is a medication called Mifeprex, which is specifically for inducing an abortion. But misoprostol is the second medication, and that was originally developed for treating ulcers and has various uses. But what it does is soften the cervix and cause your uterus to contract. And so it's the second medication that helps you actually have the abortion. That misoprostol can be used alone, and it can be used alone with about 85% success rate. So not anywhere close to what the 2-medication protocol is, which is closer to like 95-96% success rate. And of course, procedural or surgical abortion is nearly 100%. So I think that there is concern that as abortion clinics are forced to close, or we're just seeing a lot of decrease in abortion available in healthcare across the country because of all the various efforts to restrict abortion. But we want to be careful not to stigmatize people who seek abortion outside of a clinic setting and seek pills to induce abortion on their own at home, because that can be done safely. We encourage everyone to see a licensed healthcare provider, but if that's not available to you and you find another route to, say, getting misoprostol, we want to reassure people that that's not the same as like the pre-Roe days of, quote unquote back alley abortion, or, even something that is necessarily kind of taking your life into your own hands. It really isn't, and it can be very safe. So we want that, information to be available, and also I think it's a high priority for people in the movement to ensure that those who do seek self-managed abortion to not face criminal penalties or kind of be pulled into the criminal justice system as a result of that.
Absolutely. Well, I'm going to pass it over to Anwen, because on the topic of prescriptions and women getting these services that they need kind of through more and more medication route, she has some really great questions about that. So Anwen, on to you.
Great, thank you. So one barrier to getting on birth control, even in normal circumstances, is its accessibility, as most birth control requires a consult with a healthcare provider, and then it's not available over the counter. So in light of COVID-19, has gender justice seen additional difficulties in people getting birth control?
So that is not something that I am aware of, directly. I think it makes sense in the way that people are struggling to get, anything that they need. That probably also applies to birth control. But I have, I'm just checking for something really quickly, because I just heard recently that there was some success in the state legislature here in Minnesota in passing a bill that would allow pharmacists to prescribe birth control. So you wouldn't have to go see a healthcare provider. It's not quite the same as it being over the counter, obviously, because the pharmacist still needs to prescribe, but it allows you to skip going to the doctor and just being able to go to the pharmacy to get your medication, which would be a significant improvement in access.
Right. And on that point, are there other ways that you are aware of or legislators are working on to make contraception easier to access, or that you'd like to see?
Yeah, I mean, I think that we would support the effort for birth control to be made available over the counter. Certainly at this point, 50, 60 years into our lives with birth control, I think there's a lot of familiarity, a lot of a lot of safety that's been proven, and that seems pretty like an obvious next step, is just to give that power back to the patients and to people who need contraception. We are also really concerned about the continued efforts by the Trump administration to chip away at the Affordable Care Act's copay-free coverage of contraception. You probably recall under Obama, they established that birth control was considered preventative care. And since the ACA covers preventative care without a copay, you could get birth control without paying for it. The Trump administration has had that regulation in its sight since the get-go, has taken a number of steps to chip away at it. There is a case being argued, I think this week, I want to say, in front of the Supreme Court with kind of yet another effort to undermine that coverage. It's the Little Sisters, it's the Catholic nuns case, that again, taking another strike at it, which, you all probably remember the Hobby Lobby case, which was trying to exempt, religious private industries from providing copay-free contraception coverage in their employee healthcare plans. And unfortunately, that was kind of the first dig of many. So, we would really like to see the state of Minnesota pass legislation to ensure that coverage for contraception will remain copay-free in the state of Minnesota, regardless of what the federal government does.
Great. Kristen or Anna, do you have any other follow-up questions on birth control or contraceptives?
Yeah, I was curious about the bill that you mentioned in Minnesota. Do you know if it was kind of stipulating that this was a temporary measure just during coronavirus, or would this be something that you think after coronavirus relaxes more, and would it go back to, the pharmacist can't?
Yeah, I don't know off the top of my head. I'm sorry. I haven't been super directly involved in that effort. NARAL, Pro-Choice Minnesota, I know, has been really involved here. I know, what I do know is that effort, to bring about, to move that bill forward was happening pre-COVID. So I hope that it will be in place even after the pandemic, but I can't say for sure.
That's all for me.
And we had a few questions about childbirth for you as well. So this one's pretty broad, but just in general, how is COVID-19 affecting pregnant people?
Well, I think it's really scary for folks. I have, a number of friends or family who are pregnant or have given birth during the pandemic or just prior to the pandemic really setting in. And, especially for those where they're becoming a parent for the first time, that is such an intense experience all on its own. And then to layer in the social isolation, the heightened fear around accessing healthcare, I think that's something that new parents and pregnant people both are really having, is creating a lot of stress in their lives, is that if they need healthcare, they're kind of doing this assessment of, is it worth putting myself at risk of getting COVID? And needing to get more healthcare or kind of get consultation by phone rather than being seen in person for an experience that typically can be pretty hands-on, right? And so I think it just adds a tremendous layer of stress. I think it takes a toll emotionally on pregnant people to experience the social isolation. It's typically a time of baby showers and family support and people coming together to celebrate a new member of the family. So that's kind of generally, but then for people who are giving birth during the pandemic, I know that there are just a lot of concerns in that the information keeps changing. It's like you read in the paper one day, no one can be with you while you're giving birth. Like it's you and the healthcare provider, and your spouse or your partner or your mom or whomever can't come to the hospital or to the birth center. Then you hear, no, now they're letting one person in, but maybe only for this long, and everyone has to wear masks. And, I think that is really hard to face, going through, a day, two, who knows, labor can go on a long time, and to just kind of be there on your own, I think has significant emotional consequences for new parents. And then I know we've also heard that if the birthing parent tests positive for COVID, that one of the results may be that they're separated from their newborn immediately, in order to try and keep the newborn from getting COVID. And, that is just completely heartbreaking to not have that like critical time as a new parent to bond, to establish breastfeeding in a more, typical way. It's extremely disruptive and extremely, extremely scary and stressful.
Oh, I bet. And so you mentioned that, people who are pregnant are kind of making really tough decisions about whether they go into the hospital and when they do that. Have you seen people maybe foregoing traditional checkups that they would usually have throughout their pregnancy?
I don't know. I don't think I can speak to that.
And it's okay if you can't do this one either, but have you seen more people, having children at home instead of going to the hospital?
Well, I do know, and that just because I, see on social media, or kind of in various channels where we're connected with birth centers, freestanding, non-hospital related birth centers that are run and staffed by primarily midwives and nurses, is that they are having more and more patients transfer from hospitals to their freestanding birth centers, so that they can continue their pregnancy related care and their birthing plan without having to visit a hospital. And so it's been great that alternative is available for folks. I know for some of the birth centers, it has created a burden in that, because more people are unemployed, more people are enrolled in Medicaid, and the reimbursement rate for freestanding birth clinics and midwives for Medicaid patients does not cover the cost to the birth center. And so one of the birth centers in St. Paul, I saw, it has been talking about how, while they're very happy to serve and very happy to have patients transferring to their birth center, it's actually putting a significant financial burden on them for that reason. And that Medicaid reimbursement issue is something that we see with abortion clinics as well, especially abortions that are a little later in pregnancy, more in the second trimester. The Medicaid reimbursement rate here in Minnesota, and this is pretty much the case across the country, doesn't come close to covering the actual cost of the abortion for the clinic. And so both birth centers and abortion clinics are put in this really difficult position of needing to provide care, but not being compensated for it by the state government.
And you've covered a lot on this point. It sounds like there's, additional challenges in terms of the isolation during the pregnancy, access to healthcare, the financial burden of maybe, being out of work at this time while you're pregnant. Are there any additional, difficulties or dangers to pregnant people during this time, or mothers during this time?
Well, we know that pregnancy discrimination in the workplace, despite many social advances, despite many laws, including the Women's Economic Security Act here in Minnesota, a number of both federal and state laws that are intended to provide protections for pregnant people at work, and reduce, sex-based discrimination in general, it nonetheless continues. Gender Justice has a case actually in North Dakota of a server at a fancy steak restaurant who informed her boss that she was pregnant and was fired on the spot. And we have had, cases of teachers whose requests for accommodations during pregnancy, basically force them out of their jobs as well. And I think in this time, when so many people who are considered essential workers, like, people working at grocery stores, people working at pharmacies, people work, providing kind of the services that we rely on for the rest of us to survive, they tend to be, lower wage jobs. They are disproportionately staffed by women of color in particular. And those are the people who already are likely to experience pregnancy discrimination. So if you're a low wage, woman of color working at the grocery store, checking people out, and your doctor tells you you need an accommodation for a stool so that you can sit more often throughout your shift or what have you. Those are the sorts of things that, although it's mind-boggling, still create a lot of problems for workers. Bosses do not want to accommodate pregnant people quite often. And so I think, you layer those experiences into COVID, where there's people are putting themselves at risk showing up to work, and employers are really feeling the strain of trying to survive in this environment. And we have not received calls directly, like we don't have a new case or anything at Gender Justice on the subject, but I would not be at all surprised to hear that pregnancy discrimination is running rampant in this time, in particular in those kind of low wage service industry jobs.
Yeah, thanks for that answer. I wonder if I can jump in here. I think you hit on a lot of really important topics there, and one of the things that I was interested in unpacking a little bit more, we've heard all the things about how the coronavirus death rates or hospitalizations are having like a disproportionate impact on communities of color, and I wonder if you can speak at all to the ways the pandemic is specifically affecting women of color in their in their quest for reproductive health.
Mm-hmm. Yes. So, I think we're seeing just generally that the pandemic is really, I wish I had a better metaphor for it, but it's almost like, it's shining a bright light, or it's like pouring gasoline on the injustices that are built into our system to begin with, right? Like everything that we all knew existed before is just like blooming like crazy. Like all the weeds are growing really fast. Mm-hmm. And so we are seeing the death tolls, especially for African American, Black Americans, being way disproportionately higher than for white folks in this country. And COVID does seem to affect men more than women. So, just in terms of the fatality rates, that is, that has like the opposite kind of gendered effect than maybe you would expect. But without a doubt, the people who are in jobs most being asked to put themselves at risk during the pandemic are predominantly women workers, whether they're in healthcare or in service industries like, grocery store workers. And they are disproportionately more likely to be people of color. And so, that's one of the things that I really hope is a lesson that we take away from this experience as a country. For instance, when you look at how the debate around immigrants and immigration has unfolded over the last decade or so, there is almost this mythology that immigrants are here to like take from our country rather than contribute. And this experience should demonstrate to all of us how literally our world would come to a stop without immigrant workers and immigrant labor. Right now, there's a lot of discussion around access to meat, right? And, the pork processing plants and those sorts of things. If the immigrant workers get sick or are unavailable to work, like we will all be vegetarians. And I'm not going to argue about whether that would be a good thing or a bad thing. But I think over and over, hopefully, Americans are paying attention to the fact like, oh, this is actually how our economy works. This is actually how our lives function. All of these things that I take for granted and take advantage of each day throughout my life, being able to go to the grocery store and get the food that I need, being able to go pick up my prescription, You know, they don't happen without low-wage workers, without immigrants being able to do their jobs. And maybe we should put some priority on helping those people have, you know, happy, successful, healthy lives as well, rather than just take them for granted.
Yeah, I think, you know, it's really interesting and disheartening to see how the coronavirus pandemic has affected like various particularly vulnerable groups. You know, I think the immigrant population, as well as people of color. One other group I was hoping we could talk about is LGBTQ folks. And, you know, I think that there are obvious barriers that those folks have in already accessing healthcare, and specifically reproductive health care. So I wonder if that is also a population that is particularly at risk from some of these factors.
For sure. I mean, trans people in particular are experience the highest rates of unemployment in regular times. So, you know, for there to be mass unemployment is, you know, going to hit the LGBTQ community and in particular the transgender community especially hard. Completely agree about the barriers to healthcare. I mean, it's something that we see over and over again, that LGBTQ people, you know, have a very complicated relationship with the healthcare system, don't necessarily feel recognized, supported, you know, treated with dignity and humanity in the best of times. And so if you are an LGBTQ person who has had that type of experience with the healthcare system previously, and you think maybe you're getting sick and you have to make that assessment of, are you going to seek care? Are you going to wait it out? You know, with so much conflicting information about, should you go in? Should you not? Is there even a test available for you? Can they even do anything for you? You know, I think it's confusing for anybody to try and navigate what their relationship with the healthcare system should be right now, whether you think you might have COVID or you have any other issue going on, where normally you might seek a doctor's help. For LGBTQ people in particular, it's just another layer of, do I want to subject myself to discrimination or to, you know, just not being treated as my actual self in that moment? Like, do I, you know, is that something that I can take on right now, is risking that experience? And, you know, hopefully if people are sick, they are going to the doctor, they are getting the help that they need. But I think it is important for everyone to be aware that for some of us, there's like an extra layer of barrier to getting the help you need.
Great. And I know we've covered a lot of ground today, so I'm just going to try to ask a wrap-up question and think about, and you've already talked about this quite a bit, but different things that we would like to see from our federal government or our state government to protect some of the rights that are at risk here, and especially those people who are more at risk. Are there things that you're seeing in some states that you'd like Minnesota to do? Obviously, we don't have high hopes for what the federal government would do, but if it were functioning right, like, are there things that we would want to do there, lessons that we can learn, hopefully?
Yeah. I mean, so here in Minnesota, gender justice is one of the, well, we're co-counsel on a lawsuit right now to remove the abortion restrictions in the state. Doe v. Minnesota is that case. And we help lead a campaign called Unrestrict Minnesota, which exists to educate everybody about the fact that the restrictions exist currently and what the impact of those restrictions are. I would love to see the legislature remove those restrictions. One of them is requiring that abortion is provided by a physician, when in other states, including states like Montana and West Virginia, advanced practice clinicians like nurses and midwives are performing abortions and have been shown to be perfectly capable of providing safe abortion care. That would go a long way in the environment that we're in right now, to being able to expand access to abortion if nurses and midwives could provide care here. A lot of the restrictions that we have are just completely arbitrary, made up barriers for people to jump over, like the 24-hour waiting period, the parental notification requirement for minors, that if you're, not able to talk to your parents about your decision to have an abortion, forces you to get a judicial bypass, which in the midst of COVID, is even more complicated. You have to figure out how to get out of your house to go see a judge before you can go to get your abortion. So I think, like so many things, this pandemic shines a light on how many laws and regulations we have that don't serve us, that really are designed to create barriers for people to the healthcare that they need. They're purely political, not related to public health at all. And I would say across the board, our abortion restrictions fall into that category. So I'd love to see those removed. I would like to see, Medicaid reimbursement rates, like I mentioned, addressed and increased. I would like to see that the state really ensure that we're tracking the pandemic by, various demographic trackers like race, gender, so that we have a good sense of who's getting sick, who's dying, who's getting tested or not tested. I think it feels hard to think about trying to put any more burden on the healthcare industry right now to, also kind of like write down data. But I think we can't possibly understand on the other side of this how different communities were affected or maybe not served without some data to help us understand that. And then at the federal level, there is a bill that would stop abortion restrictions. It's called the Women's Health Protection Act, and it's really designed to keep states from passing what we call TRAP laws, targeted regulations of abortion providers. And those are the types of laws that in many states have been the primary driver of shutting down abortion clinics and really drying up abortion access in those states. We have managed to avoid most of those really extreme regulations here in Minnesota, like requiring abortion clinics to be surgical centers, for instance, which again has no relationship to what is required for providing abortion. But that would be a place where the federal government could definitely make a difference in ensuring access, and sadly is extremely unlikely in the current political climate.
Well, great. I think that I want to say thank you. I think that you hit on so many different interesting points and that this was really illuminating. I'm hopeful to see some of the great work that Gender Justice is able to do going forward, maybe get some of those, movement building bills passed, fingers crossed. And thank you for just sharing your time and helping us to better understand what's going on in the pandemic here.
Absolutely. Thank you. Thanks for your excellent questions.